Thank you so much. So, Elise, this is Senator Anwar. I wanted to thank you for willingness to speak to me and your willingness to have your voice and your story recorded. Can you hear me well?
Yes. Thank you for having me.
Okay. So, Elise, which nursing care facility do you work for?
I work for First River Healthcare in East Windsor.
Okay. And I know we had a conversation with you before, and I learned about some of your exposures and what you had developed. So tell me what happened to you and what disease did you develop?
Well, I tested positive for COVID-19, the coronavirus. I work at First River, like I said, long-term care facility. And I'm, pretty sure that it happened on a particular day when I was exposed without my mask on while I was eating lunch to another. Actually, it's an outsourced company who comes in. There was an employee that was coughing in one of the rooms where I was eating my lunch, and I started showing symptoms the Monday after that, and that happened on a Friday. I was tested on that following Thursday, received the results on Friday, and until now, I haven't had nobody from management has even called to check on me. How are you? How's your family? Basically, it's just negligent, completely negligent. And I did call the facility and speak with the infection control nurse just so she can check on that particular employee to be sure that they weren't continuing, to work in the building sick. So
Elise, thank you for sharing that. Now, I know
the DPH, supposedly they came in on Thursday. I want to say it was the 23rd, Thursday the 23rd. They came in to check how the facility was handling the outbreak and everything. We never seen them. They didn't come on the floor and talk to the employees, to my knowledge. But I don't know about that.
Okay. And tell me about the availability of PPEs at the place.
Well, the PPE was unavailable for a while, and then when it did become, well, I guess the government gave the facility money to purchase, and the administrator kept the PPE in his office. And I asked him personally why he wasn't distributing it, and basically the answer got they were waiting until they felt the need for it. I guess if there was enough positive patients, then they would distribute the PPE. But it took a while. I think it was about 11 days from the first day they received it until the day that they distributed the PPE. But by then we had so many sick patients, and that was only because I guess the state came and they complained. But we had so many sick patients by then. As of right now, to my knowledge, we have 15 staff members that are positive, 3 that are pending. Every patient was just tested in the building yesterday. And patients they're dying. Just a lot of them.
So Elise, I'm going to repeat what you have said because I think it's important. So you're an LPN that worked at this facility, the Fresh River in East Windsor, and when the pandemic had started, you were first without any PPEs, and then there were no PPEs that were given. When the PPEs were available, the administrator kept them locked in the room, and it was not accessible to the staff, whether it was the CNAs, whether it was the nurses, and they did not have access to the PPEs, and as a result, they were taking care of the patients without any protections. The patient were unprotected, and the workforce was unprotected, and now we have 15 employees that have been COVID positive, and there are many patients who have been COVID positive. Is that correct?
Yes, correct.
And this is why we have a pandemic and the concern about the pandemic that is going around. And I heard from you yesterday, and then I'm glad. And then the sad thing is we had this conversation on the Nurses Day that we are celebrating. And here we are learning about on the Nurses Day that the nurses are not even getting the protection, had not been getting the protection to even protect themselves and then protect their patients. And the patients were getting exposed in this situation. Elise, could you tell me, were you one of the ones who had to buy their own gowns?
Yes. The minute I heard that we had a positive patient in the building, I purchased a rain suit. So I was coming to work in my own rain suit, jacket and pants suit, and face shield. I had, gotten my own gear, my own goggles. The ones they gave wouldn't go over my glasses. So, I mean, they were useless. A lot of the staff, that's what we ended up having to do, purchase our own stuff. They did give out the surgical mask, and that was the only PPE we had for a while, and we had to use them for about a week before they would give us a new one. And, I mean, at one point, and then after that, they did give KN95 mask out to the staff, and that was after a while. And then eventually the suits were distributed, and then later that day that the suits were distributed, when we were hanging them up, no, the next day, I'm sorry, it was on the weekend, they had a face shield, a homemade face shield with the suit on the following Saturday morning. I believe that was the 25th. Now, the administrator actually had a nice N95 mask before they even handed out our KN95 mask. Him and the supply lady were the only two that we've seen with the proper, the real N95 mask that we used to use in the building. The CNAs used to be able to use them to take the patients to smoke, but once the pandemic started, they all disappeared. They were actually in the supply closet before the coronavirus, was very prevalent in Connecticut, and then they were just all gone because I guess they didn't want staff to use them, so they took them out of the supply closet.
Okay. So I'll repeat if I understood you correctly. You're saying that you received, or some of the people, the only thing that they received from the administration was a mask. It was a surgical mask, and that mask was for the entire week. And then people had to purchase, yourself included, your own protection to be able to survive if you could in that environment.
Yes.
And then the N95 masks were used by the administration, but not the caregivers of the patients who were receiving the care. Or the same. The care.
Right. All till now. I mean, I haven't been there in over a week, but the only people I've seen with the real N95 mask since the beginning of this was the administrator and the supply lady. The only two people I've seen with the real N95 mask. And the administrator was actually observed coming in the building with the mask on before he even gave us the staff members the KN95 mask.
Sure, Katie. So Elise, do you want to add more to what you were just sharing with us?
Not really. I mean, that's basically it. We were already all exposed, before they bring in the proper PPE. And I wouldn't even say proper because, I mean, the PPE, the suits on the staff after one shift, they tore on a lot of the people. They never sized anybody. So the PPE, some of the PPE didn't even fit some of the employees.
Okay, so you did not even have, I mean, there was no N95, so there was no fit testing or anything at all. So
no, not at all.
Thank you so much, Elise. Thank you so much, and I so much appreciate your willingness to stand up and share stories so that we can share this story, and then we can actually look at and shed some light on what's going on in some of the facilities, and this is something that is putting the lives of the workforce in danger. This is putting the lives of the patients in danger in nursing homes, and this is something that we should have zero tolerance for in every shape or form. So I want to thank you for your willingness to stand up and sharing your story.
Thank you.
What I want to do is, Allison, do you want to share a little bit about, please?
No, I heard Elise say that they had homemade face shields. What type of homemade face shields?
Well, actually, the ones that they supplied were literally like plastic. It looks almost like they took the plastic out of a picture frame with a piece of foam glued to the top of it with elastic that was stapled, like, just a regular stapler, stapled together. And those are the face shields that they provided. And we were told a major issue, I'm just going to say this, a major issue, we're having a lot of cross-contamination, a lot of negative patients positive patients being transferred into negative patients' rooms, and those patients turning positive. And more importantly, when they did provide those homemade face shields, they decided we can no longer use a disposable surgical mask over the KN95, which was the practice we were first told to do when you're entering a positive patient's room, because you're not supposed to go from a positive patient, then go care for a negative patient with the same PPE. So we were disposing, using a surgical mask over the KN95, then disposing it, and they decided once they provided those homemade face shields, could no longer do that. So you only have, the KN95. And so you're going from room to room, patient to patient, positive and negative, with the same face mask.
Okay.
And like I said, the building shows for itself, because as of, I want to say yesterday, they had to test all the patients. The medical director ordered all the patients to be tested. But as the day passes, more staff are texting me they're positive. No management is checking on any of these staff members.
Yeah. Okay, this is helpful. So again, I heard you say that they were actually keeping the patients in similar rooms. You could have a COVID patient with a non-COVID patient in the same room.
They have a very, I'm gonna say, sloppy way of dealing with positive and negative. They're playing basically musical beds and moving positive patients that are confirmed positive down into patients' rooms that are negative. I can give you an example. There was one particular patient that tested positive on the 3rd floor. They moved that patient down into a room on the 2nd floor with a patient that was, not tested and wasn't showing symptoms. That patient turned positive, okay, no longer in that room. Then they took that positive patient, shipped her out to another building, so that opened up that same bed. Then now they have a negative. There was a patient that was tested negative, okay, and confirmed negative. They moved a probable positive patient into that room. That patient turned positive. Now that roommate, which was previously tested negative, is now positive. It's totally senseless what they're doing. It's almost as if they want the virus to spread to, I don't know what their motive is, but it's so backward. They're putting patients at risk, staff at risk,